We look at the next trauma-related issue we should be discussing on orthopedics, and this is what is known as a post-traumatic stiffness. Post-traumatic stiffness. All right, so just like the name implies, post is like after, traumatic is trauma, stiffness is like, yeah, I'm stiff, I'm not able to move this part of the body like I used to, So it just refers to the loss of what? Normal joint mobility, and this follows an injury, so you have had a trauma related issue like fractures, like dislocation, like ligament injuries, like surgeries. So after the event, you are now becoming so stiff, okay, because of probably you kept that part of the body for a long time before without using it, okay, could be. So causes: prolonged immobilization, so maybe they cast, they splint, they brace. Soft tissue contraction, so the muscles, the tendons, the ligaments are tightening. Then joint capsule fibrosis, scar tissue formations, issues, and all of that. The intra-articular adhesions, where the scar tissue is inside the joint. They also have the heterotopic ossification, where there's abnormal bone formation in soft tissues. Then pain avoidance, so sometimes some patients they limit movement due to discomfort. So commonly affected areas include the elbow. So elbow is very prone to stiffness, after fractures or dislocation. You go have the knee, where a post ligament surgery or fracture. It could be the shoulder, where there's like an adhesive or capsulitis after a trauma. Then hand and wrist following a tendon injury or fracture. So clinical features is this. There's reduced range of motion. There's pain or discomfort with movement. There's functional limitations, like you're not able to use that part of the body very well. Difficulties in walking, difficulties in lifting stuff, difficulties in grasping. Then muscle weakness due to disuse. Okay, so management is this: early mobilization. So in as much as there's a surgery, there's an issue with your legs or so, you start using it quick. Physical therapies like stretching, strengthenings, and joint mobilization. There's splints and braces. Okay, then medications, where using those pain relievers, anti-inflammatory agents. So surgical options is what? Arthrolysis, then surgical release of adhesions, then capsular release, and also excision of what? Heterotopic bone. Okay, so that's what we got for this.